Hey guys, it's Cheyenne and welcome back to my channel. Today I'm going to be going through some comments on my dental assisting videos and answering any questions that you guys may have. Again, I want to remind you guys to please leave comments and ask questions. I love answering them and I love trying to help as much as I can. So I've gotten a few comments, so I just wanted to do a little video here and try to answer some of them for you guys. I'm going to try to pronounce these usernames, but I'll throw up a screenshot of the actual question because I will probably butcher it, and I'm so sorry if I do. But the first comment was from, it's like Fur MS, and it says, what is your favorite part of assisting? And then with kids, what is your best suggestion on working with them? And it says, thanks. And thank you for leaving a comment. But my favorite part of assisting would have to be that even though some people think that it's boring and doing the same thing all the time, I personally do not feel that way. I feel that every day is something new, usually have different patients, and I love that you constantly can learn and grow within dental. And there's always new products that you can learn, and there's always something more that you can do. I have started and I've just kind of climbed this ladder of learning more and more and more. And honestly, I'm never bored. There's always something to learn. And even if you're bored within dental assisting, you could try to learn ortho or maybe do oral surgery or pedo or, learn more about what the girls are doing up front or sterile or whatever it may be. I just think that it's constantly interesting, and some people may disagree and say that it's super boring, but I think if you have the right mindset that it can be really interesting, and I don't really think it's boring at all, but that's just my personal opinion. I feel that every patient's different, and there's always something new that I'm learning. I just learned something new the other day that I had no clue it was. It was called a second division block, and it's a different type of injection that you actually do through the palate and the hard palate. And there's actually like a soft spot that the dentist looks for. Never heard of that injection before in my life, but I learned about it yesterday and I was like, wow, something new. Who would have known? But that's my favorite part about assisting, is that there's always something new to learn. Oops, sorry, this closed off. Let me get back into this. With kids, what is your best suggestion on working with them? I don't work in a pedo office. I've never worked in a pedo office. I have worked in a school-based program where we did sealants and fluoride. My biggest suggestion for working with kids is, which some people are probably going to hate this, but I've come to learn that, and I'm even going to say that when I have children, I don't know if I could do this, but there are some children that just behave a little bit better when their parent is not in the room. And I totally understand when you bring your child, that maybe if you want to go in the room at first and then just kind of, making sure you're comfortable within the office. I mean, you should never bring your child to an office you're not comfortable with or a doctor you're not comfortable with. But if you want to go back there at first, but if they're doing like an extraction or getting injections or stuff like that, children usually behave a little bit better when their parents are not in the room. And I know some people are going to be like, oh my God, like I have to be there. Believe me, we let parents in the room in my office, but there is some times where I'm like, oh, I really wish this parent just wasn't here because we'd be able to do this filling. And some children, they just behave better. Children, they see their parent there and they're trying to get out of being there. So they're trying to say things are hurting when they shouldn't be, or they're trying to play up the card, or they're constantly asking questions. Some just behave a little bit better, but my suggestion also too is to keep them occupied. So we have like little stress balls that we give out that kids can play with and hold. You want to communicate with children. They want to know what's happening. So be very like, okay, this is the suction. This is gonna, suck the saliva out of your mouth. You can give little nicknames, whatever you want to call the suction, but like the little handpiece we call Mr. Bumpy. They just want to be told what's happening. You don't want to surprise them or keep them in the dark. Again, some children do great with their parents in the room. They're fantastic. But others, maybe if you could send a different relative or something so they're not trying to get out of the procedure. Because what makes me sad is when you have a child in there and then we have to refer them to pedo, and then they usually have to be sedated to get work done if we can't do it in our office, which, you know, it will make the experience better for the kid because they'll be asleep, but it would have been nice if they could have just not had that fear of the dentist. Also, this is turning into my suggestions to parents. But oh God, when parents come into a room in the dental office, do not tell your child about your previous dental experiences. Don't make them scared. Let them, you know, learn from themselves and have their own experience. I don't know how many times I've been in an office and a child's coming for a filling and one of their parents is there and the parent is like, oh yeah, I had my tooth ripped out. It was the worst experience ever. And the needle hurts so bad. And I'm just like, why are you telling this to your child? Do not tell your child this. Yeah, don't tell them those type of things. Let them have their own experience. We don't want children scared of the dentist. I understand that everyone has bad experiences, especially at the dentist. Nobody likes the dentist. But just let them have their own experience and don't tell them about yours. It's not helpful. It just makes them scared. And we don't want them to be scared. Moving on, sorry I blabbed so much. Here's another question. It's, oh gosh, I'm gonna butcher this. The Fia 25? The Fia? I don't know, that's a cute cat in your photo. But anyways, it says, hi Cheyenne, thanks for the video. Oh God, I'm drooling. I'm interested in dental assisting, but someone asked me if I'm concerned with radiation exposure and taking x-rays and being around it. Was that ever a concern for you? Thanks. I had thought about that, but there are precautions that you take. I mean, yes, we take multiple x-rays a day. We take tons and tons of x-rays a day, but there are precautions within your office they should be taking. So you are supposed to be 6 feet away when pressing the button. You should have a lead wall in between you and the x-ray machine. In offices, you do wear little radiation badges and you're supposed to send those in every few months or so. And then if you've had too much radiation exposure, then you cannot be taking any more x-rays. I've had those taken multiple times. I've never been anywhere near, you know, a limit to where it was considered for me not to take x-rays. And then honestly, dental x-rays are very, very low radiation. We have patients all the time that are saying that they don't want x-rays or they don't want to take x-rays because of the radiation, but they're so low, they're nothing compared to medical. Like a full set of x-rays in a dental office is 18 films. And a full set is equivalent to 30 minutes of you being out in the sun. So it's hardly anything. So no, that's not really a concern for me. I know a lot of pregnant girls, when they work in dental offices, they do sell like these lead like stomach wraps you can wear that go inside if you want extra protection, which I probably would if I ever was pregnant working in a dental office. But no, I'm not concerned about it with every day-to-day working. So this is a very long comment and I totally love it and appreciate that you went and spent this much time to comment on my video. You're amazing, and I think it's Ren Fair Goddess, but it says, does HIPAA apply to dental? And it says, if so, that would definitely be a reason to not film in your office. Yes, HIPAA does apply to dental, and that is a reason why you should not film in your office. I would never film a patient or anything like that without consent. And when I worked in the school-based programs, you would get consent from their parents to allow children to be in photographs and things like that. But yeah, that is definitely why you cannot film in a dental office. You would have to get a written consent from a patient saying that they did not mind for their, you know, procedure or whatever to be filmed. You have to be really careful with HIPAA in dental. And you have to think about little things like if you go to the grocery store and see a patient, even if you're the best of friends, but if you just know them from the office, you can't run up to them and be like, oh, hey, it's me, Cheyenne, you're a dental assistant, because you're not supposed to put out there that they've been in your dental office. If someone calls your dental office and then asks like, is so-and-so there for an appointment, or when so-and-so's appointment, you can't give that type of information. You also have to be really careful about locking your computers when patients are around schedules. They can't see what other people are there for or whatnot. You know, you don't know what could happen. You could have an ex-husband there in the morning and his ex-wife could be coming there in the afternoon. And if he sees that, who knows? He could come and, you know, whatever. But you have to be really careful about that in the dental office. She also gave a suggestion. She's like, maybe you could borrow a set of teeth and instruments to talk us through a checkup. That'd be fun. I could definitely do that. Um, how does your office deal with anxious patients? My office in particular and other offices I've worked in, nitrous is kind of not a thing anymore. Some offices still do use it, but some offices are kind of getting rid of it, probably because it's a little unsafe for the assistant and the dentist. Sometimes it escapes, and we breathe it in and it's not the safest for us. It also doesn't have a huge impact on adults. It's mostly for children. So a lot of the times nowadays, if your office does not do sedation, which my office doesn't, we do something called oral sedation, which is a pill. It's called Ativan or Halcion. And it's kind of like a Valium. You take that an hour before your appointment. You gotta make sure you have a driver and things like that. But you take that an hour before your appointment, and then you come in and you're kind of just like tired and a little out of it. You're just very relaxed. And it does help with people that are anxious. But there are offices that do sedation. Oral surgery, of course, does sedation where you're completely asleep, but we don't do that. And a lot of people don't usually want to do that just for routine fillings and things like that. But if you are an extremely anxious person, I would recommend Ativan or Halcion for the oral sedation because it really does help. Oh, let's see what else. Let's see. Oh, and then she's just telling a story about a time that she had like a panic attack in the office, which breaks my heart. It's hard to see, and I feel so bad for people that are scared of the dentist. Oh, and then she talks about gag reflexes. So yeah, gag reflexes are a little bit challenging. It sounds really funny, but the thing that's really helped me with taking like x-rays or impressions is you just try to preoccupy the person. And a lot of people might watch this and be like, I completely disagree, but gag reflexes is all in the mind. So I usually tell the patient to wiggle their toes. And first they look at me like I'm freaking crazy, but when they start wiggling their toes, they're not thinking about what's in their mouth. And it usually can get them through enough for me to go push the button and take the x-ray. But yes, you just want to distract them. So I say to wiggle their toes. There is a spray that you can use that you spray inside the mouth and it numbs the tissue. So it can numb like the tongue or the gums. That does help for some people, but it kind of has like a nasty taste. There's like strawberry and things like that, but ugh, it doesn't taste very good. But you definitely can use that. But yes, the main thing about gag reflexes is just distracting them, because even though they may have a gag reflex, we still have to take x-rays and we still have to do impressions. There's really no way around it. What I think is more challenging is people with tori. Tori is extra bone growth in your mouth. So here, I'll just show my mouth for an example. I don't have any, but it's where your bone has grown and then your tissue covered, of course. But some people, they don't have this. They don't have this gap. It is completely filled in with bone, and they could have it on their hard palate as well. And to get x-rays in there is extremely difficult. So that to me is way more of a challenge than a gag reflex, because a gag reflex, I can tell them to wiggle their toes, I can tell them to wiggle their fingers, just whatever mine be. I usually can get through it. I've never had a patient that I couldn't take an x-ray or do impressions on. I've had a patient throw up before, but that's okay. I mean, we got it done and that's all that really matters. But yeah, just distract them. Okay, here is a question that was actually on my pros and cons of dental assisting video. It said, can you tell the difference between a part-time and full-time dental assistant? Is there a fixed number of hours for part-time? Now, every office is a little bit different. The office I work at now, actually, you're considered full-time if you work 30 hours or up, which is not the case usually. Usually you are full-time if you work 34 or more hours a week. But yeah, if you work 33 or less, you're usually considered part-time. But this differs. I mean, I've worked in private offices and clinics, and they're all a little bit different. The benefits are different. Clinics, you usually do have to work full-time to receive full benefits. Private offices, it just depends if you're paying for your own health insurance or whatnot. But usually it is 34 and up for full-time, and then 33 and down is part-time. Oh, I wanted to touch on this too. this was a comment that I received a while ago when I first put out this pros and cons of dental assisting. It was from Janae. Oh gosh, I'm so terrible with names. Gilchrist? I don't know. Sorry if I totally butchered that. She says, I'm a junior in high school and I want to be a pediatric dental assistant. So that means a dental assistant works with children. Maybe I misunderstood, but I thought dental assistants' main jobs were cleaning teeth and taking x-rays. Is this the case, or is there more I should know? Thanks for the help. And I did comment back on it. I said an expanded function dental assistant can only clean teeth on 12 and under. And also you will be taking x-rays and you'll be assisting the dentist during dental procedures. Also, you may have other tasks such as sterilizing instruments and chart notes. And then someone commented and said, no, your main job as an assistant is assisting the dentist. Hygienists' main jobs are cleaning teeth, scaling and root planing, sealants, and anesthesia aesthetic. Which is true, yes, 100%. A hygienist is there to clean teeth. Now, as someone that's worked in multiple different offices, different clinics, clinics and private offices, your role as a dental assistant is going to be different at each office. So it's hard to say that this is exactly what you will be doing. But yes, hygienists do go to school longer, of course. They're there for the deep cleanings. They're allowed to clean below the gum line. So they remove the calculus and the tartar. We are not allowed to go below the gum line. We're not allowed to do anything permanent. But again, I've worked in offices where I do no cleanings at all. I'm strictly assisting the dentist. I'm taking x-rays. I'm cleaning up operatories. I'm doing chart notes. I'm doing referrals, things like that. And then I've worked in offices where the hygienists only clean teeth for kids that are 12 and over because they technically have calculus, and we clean, 11 and under. So they see no patients that are 11 or under. Assistants are doing those cleanings. So every office is different. And you'll learn that. You'll go into different offices and you'll do different things and you'll have different tasks that maybe you didn't have at other offices. But the office I'm in now, if there is a child that's 11 and under, we're doing the cleanings unless the hygienist is available to help. And then the hygienist is doing 12 and up because they have calculus. And then also I place sealants in my office. The hygienist does not. We do the soft relines for dentures. We assist the doctor, things like that. So I don't like this whole category of this is strictly what hygienists do. This is strictly what dental assistants do, because it differs between every office. Every office is different. But no, if you want to clean teeth, you should be a hygienist because dental assistants do not clean teeth. But there will be times when you go into an office, and since expanded function dental assistants can clean 12 and under, they will have you clean teeth because honestly, you're cheaper to pay to clean somebody's teeth than a hygienist. So they'll have you clean 12 and under. Or in my office, it's 11 and under because 12-year-olds usually have calculus or tartar, which we suggested that because I was getting a lot of 12-year-olds that have calculus and tartar and I can't remove that. So I was constantly having to go get a hygienist to do that. And it wasn't fair because they have their own schedule and, so we suggested that and it works. I also used to work in the schools and I did children cleanings and sealants. So yes, everyone's different. But if you want to clean teeth, you should go to school to be a dental hygienist. But every office is different. So, there's some offices I've worked in where I did no dentures stuff at all. And there's some offices I worked in that I did soft relines all the time. I made temporary crowns. I did this, I did that. The office I'm in now, I do no insurance stuff at all. The last office I was in, I did referrals, I contacted the insurances, I did the pre-authorizations before we did, big procedures, and now I don't do any of that. So every office is different. But yes, if you want to clean teeth, definitely go to school to be a hygienist. You're not going to be cleaning teeth as an assistant, but there are some cases where you might, or some offices that might utilize you to clean 11 and under. But yeah, okay. I'm sorry, I blab so much about dental assisting. I can go on for hours about dental assisting, but I'm glad we did this video. I'm glad I was able to answer some questions. Again, please comment, leave questions. I love trying to answer them, sharing my knowledge. And yeah, so I hope you guys enjoyed this video and I'll see you in the next one. Bye guys.
Like this. Recognize I ain't backing down. I want more times than I can count.